Hi, I'm Gary White for Channel 6, Central Kentucky Television. I'm here with Dr. Trish Ciccone at Central Kentucky Optometric Associates. We all have our PPE on. You have your mask and your face guard, right?
And my gloves and my jacket.
You got it all going.
I got it going on here, don't I?
Because it's a safe environment for the clients here at Central Kentucky Optometric Associates. We're going to talk a little bit about that. Last time we were here, we were sitting out in the waiting area. You had just kind of reopened to the public.
So we're following the guidelines as they change and as they emerge. We're still social distancing. You can see Gary and I are still keeping our distance, but we're a little closer together because we really just want to illustrate that when you're in here for an eye exam, you know, we are going to have to get close to you, but that we are using the proper PPE to keep you safe. Your doctor will have eye coverage on. Your doctor will have a mask on, your doctor will wear gloves, and I do wear my clinic jacket mostly because I think it just keeps my clothing underneath less chance that I might take it home and bring it home with me. If in fact, in case I would ever come in contact with it. And we don't know, and I think probably the biggest unknown is, you know, if somebody is symptomatic for COVID-19, they're going to be sick and they're going to stay home. But it's the asymptomatic folks that we're still unsure of and still not quite sure how contagious it is from an asymptomatic person. And so we're just going to err on the caution that we have to assume that everybody could transmit the disease and use protection in that manner.
And even where you're sitting, I can see on the, because usually when I come in for an eye exam,
there's guards. Yeah. There's breath guards on every piece of equipment that we can put.
You're usually looking right in there.
Real close, and so we put breath guards on that too. And every room in between patients we're using it's H2O2 based cleaner, and every surface in the exam room of every piece of equipment gets disinfected in between appointments. And that's just what we're doing. And
that's right. And we do have one little tip we want to share too, as we're going through this COVID situation, and people are wearing masks. And if you have glasses, sometimes your glasses will get fogged up because you're wearing the mask. So you have some tips that might help with that situation.
A really good fitting mask will fog up less. And the key is in your mask, and you might be able to even insert this inside your mask if you don't have one that has one, but if it has a metal piece right up here, and I'm going to just do this here, right up here by the nose, just take that metal piece and just really sculpt it into your face there. And you know, it works really good is if you have a mask and you want to insert one there, is you could either maybe glue it or tack it on there, is those little tops from the coffee bags. You know how you roll a coffee bag and those little piece of wire things from those? Cut one of those off your coffee bag and glue it insert it into your mask if it's a homemade mask, and put it right there at the top of your nose, and bring it on down, you know, so that you can fold it over your nose, and that will help a lot. You can get anti-fog treatments on your lenses if you're purchasing a new pair of glasses. It's usually combined with anti-glare. So there's one called Crizal Optifog that we're using here quite a bit, and it has the anti-fog. And when you get your lenses, it'll come with a little spray that's meant to work with that coating. And you spray it. You put the spray on once or twice a week, and that helps to reduce the fogging as well. Face shields fog less than glasses do. So if you don't want to wear glasses, or if you don't have a prescription and just need something in certain situations to protect your face or your eyes, then maybe consider a face shield over your mask as opposed to just glasses, or if you can do without your glasses. It does get pretty hot back here behind this face shield and with the mask on, but I'm doing it for everybody.
Yes, absolutely. So there's some of the situations going on with the COVID situation right now here at Central Kentucky Optometric Associates. But as we said, eye care continues to be a necessity for people, and June is actually Cataract Awareness Month, right?
Yes, it's National Cataract Month, and so any folks, you know, keep up with your routine care, especially if you're of age where cataracts are running more prevalent. Make sure there's things that you can do to help reduce cataract formation, there's things that you can't do, you know, and they just sometimes are going to happen to most of us sooner or later. But protect your eyes from the sun, that reduces it. If you're a smoker, that's another reason to quit, because smoking causes cataract formation to form more readily. They tend to form more readily in folks who are diabetic. So keep your diabetes under good control. Wear ultraviolet protection when you're outdoors. Try and avoid or quit smoking. Even secondhand smoke, you want to reduce your exposure there. And then if you do feel like something's going on, come on in, because the best thing to do, I tell folks that every day, if you're going to have something wrong with your eyes, you know, a cataract is probably the easiest or the best thing to have wrong, and it's the one thing that we can fix better than anything else. Any other problem with your eyes, we can fix a cataract better than we can fix anything else. And the cataract surgeons, they are up and going again. So there's a little bit of a backlog from the shutdown, but that folks are starting to move through and getting their cataracts taken care of now. So we can get you in, we can get you scheduled, we can get that taken care of too. So you want to try and do what you can to prevent cataract formation, but then when they do have them, I tell folks this: when your vision is reduced enough where it's causing an interference in not only the things that you have to do, but the things that you like to do, and if you're uncomfortable doing them and a cataract is the cause for that, then it's time for you to think about having them removed. And that time is different for everybody. So when you have a functional complaint with either the things that you need to do or the things that you like to do, and the cataract is consistent with those complaints, you know, that's when it's time to consider having them removed. And it's a personal choice, and you decide when you're ready. Nobody else is going to decide that for you. You decide when you're ready, and then we will you know, talk to you about options, because there's all kinds of surgical options now that you have to kind of think of before you go in.
Great. Now, also, July is Eye Injury Prevention Month, because as we know, the 4th of July is there, and there's fireworks, but there's also outside, there's a lot of opportunity for injury.
Yeah, the first thing that comes to mind with July and eye safety is definitely fireworks and home fireworks. And, you know, I've just seen enough devastating things go on with that, you know, make sure that you know what you're doing, make sure that if you're shooting them off yourself, or make sure that if you're shooting them off for other people, that they're not in a close enough range, and wear eye protection if that's what you're going to do. Because those injuries can be life-threatening, they can be sight-threatening, and they can be devastating to your life. I like the fireworks from afar. I've always been that way. I've never been a fan of fireworks and the noise that they make, and but I do like to watch the ones from afar, you know. So there, and that's just right around the corner. If you're out on the water, make sure that you wear the right protection and have sun protection. You're going to get more exposure to ultraviolet because it's reflecting up off the water. So you want to do that. Contact lenses do not mix with swimming pools, rivers, streams, hot tubs. Don't wear your contact lenses, and in those situations, a pair of prescription goggles is a better choice. And never, ever, ever, ever sleep in a contact lens that you've worn in any kind of body of water, whether it be a swimming pool, a hot tub, or a green river, or, you know, Lake Michigan, or you know, the ocean. All kinds of microorganisms can cause devastating visual problems from that. So always take them out. Never sleep in them if you've been around a body or in a body of water. And I do not recommend that you wear them into a body of water.
Absolutely. And if you have any questions, you can contact Central Kentucky Optometric Associates. They have offices in Lebanon and Springfield. Give them a call to make an appointment and come in and see one of the doctors. Yeah, and we're still social distancing as far as the waiting room and all that. So when you come, if you just need to pick something out or pick something up, you know, just call the girls, be patient with us, and they will answer the phone eventually. They try and get to it. I have one employee that her whole sole job is to answer the phone. So, you know, that's all she's doing all day long is answering the phone. So there's somebody there to do it. Just sometimes if she might be on another line and somebody else can't get to the phone, just be patient with us. We're trying to work through this and keep everybody safe. Absolutely. And what are the phone numbers to call for Lebanon and Springfield?
Lebanon is 270-692-1871, and Springfield is 859-336-9388.
That's Central Kentucky Optometric Associates. This has been Gary Wick, Channel 6, Central Kentucky Television.